Nigeria's government's forum met on Wednesday to deliberate on the best way to keep the coronavirus pandemic at bay. At the end of the meeting, they proposed an interstate border lockdown, which means that there won't be any form of movement into or out of any of the states of the Federation by anyone for another 2-week period. Now, because of that, questions have been raised about some quarters in terms of effectiveness of the lockdowns, or that the government should look inward for better preventative measures. To discuss this, public affairs analyst Victor Okhai joins us now to take a look at these mind-boggling questions. Good morning to you, sir. Thank you for joining us. What are your thoughts, first of all, on the lockdown? Do you think it's doing more harm than good, or do you think that it is an absolute necessary measure to keep the people safe? What are your thoughts?
Well, thank you very much. My thoughts on lockdown cannot be separated from how the lockdown was implemented in Nigeria. Lockdown on its own is a very good strategy, but as was implemented in Nigeria, if you ask me, was a near disaster. And the reason is simple. When the index case was first discovered in Lagos, initially, Lagos decided, or people in Lagos, went into isolation. And then a week later, the federal government decided to, declare the lockdown in about 3 states. Ogun State, Lagos State, and the Federal Capital Territory. Now, I thought that was a mistake because, if you're saying that people should isolate and stay at home, and, you declare a lockdown and the roads are porous, people are traveling, and we know that the coronavirus does not travel, but people travel. It doesn't move. People move. People take it from one point to the other. I felt that at the time, whether or not, because unless you have adequate testing kit, you cannot say where people already have, the virus. You cannot say that some states don't have, a case yet. People travel into the country every day. People travel across states every day. And Nigeria is big and wide. So I felt that the first 14 days that was declared nationally should have been across board. And then the second chance we had, we blew it as well. That's when this should have been across board, across the entire nation, and every state border should have been locked down. And the reason is because there's a gestation period within which this virus will manifest in carriers. And even if people are pretending and all that, they'll begin to break down at home, and these cases will come to the fore. Even if you don't have testing kits, you would see cases of people who are already down with it, and then the medical personnel would respond to it. But now what has happened, people have traveled, and now it is so widespread. We have seen what is happening in Kano. Now we've seen situations where the Almajiris are being evacuated from Kano to neighboring states like Jigawa and some of the states around. And it's so messy, if you excuse my use of the language on air. What should have been done should have been a lockdown across board. What a lockdown does, like I said earlier on, is that you stop the movement of the disease, and it also enables those who are with it, who will break down with it, to manifest, and those who are positive but are symptomatic, within that period they are in isolation. They don't go out and infect other people, and then when they turn negative, eventually they turn negative within isolation. So in summary, lockdown is good, but it was very poorly handled in Nigeria. There are other factors, economic and the rest. We can talk about that as we move along, of course.
Surely we can. And only this morning, the NCDC, Nigeria Center for Disease Control, has come out to say it is not yet time for us to begin to even ponder on, lifting this lockdown. If that is the case, what then? Because on the other hand, the NLC is saying, nope, you cannot continue this lockdown, otherwise we'll have a very, very serious problem on our hands. So the question is, can Nigeria afford,
extending this lockdown, considering the fact that from 27th of February, when we recorded the index case, we now have over 1,000, and today is 25th of April. That's within a space of 2 or 3 months, if depends on your calculation. Where does that leave us? What is the next line of action if NLC is saying we cannot afford an extended lockdown and the NCDC is saying we have to lock down?
Well, first, to say that we have only 1,000 cases, tested, of course, officially. It's like saying, there's an analogy I usually would use when we say we generate only 3,000 to 5,000 megawatts of electricity. That is a fallacy, because if you bring into the power grid all the generators and the independent powers, by industries and all that, it's much more, so official figures have a way of misleading us and giving us a false sense of security. Now, if the federal government had not bundled this, I'm not laying blames here, but we still have to say it. I don't know any other way to put it. We do not need to pretend about it. Now, there are complications that are going to arise from this because of the poor handling, ab initio. Now, would you blame the NLC? I can understand. The NLC is, the NLC would be concerned about, labor, would be concerned naturally about people who are earning daily income. And of course, there are no visible palliatives. We don't have a database from which to effectively, people have said, okay, they will use BVN, they'll check minimum amount and all of that. There's so many people who don't bank, so you may even be sending money to people who have who have a lot of money in their homes, and then those who really are hungry, who have 10,000, so you don't give them. Meanwhile, they have obligations that are much more because their children are going back to school immediately. So a man who has 15,000 is not entitled to a palliative, and then meanwhile, he has to pay school fees as soon as you resume. He has to pay house rent and all of that. So now the thing is, where do we go from here? What do we do? How do we handle this? Because obviously, NLC has a case, the NCDC has a case. If you do not do the lockdown, then there's going to be a problem. But there are other ways out of it. Look at this example of Czechoslovakia, for instance. The video has been doing the rounds. It's gone viral, where they use face masks. There are other ways of dealing with this. Like we say, if people don't move, the virus does not move. And so the thing is, because of the peculiar nature of our people as Africans, as Nigerians, and the fact that the way we earn money here and we don't have a social security system, so we can't even talk about any. But if we were to say, how we take care of our people is almost non-existent, So the thing to do is, one, the issue of mask, I think, is very, very important. But before you enforce that, then you have to make sure that you have produced enough masks or empower people to produce. If you have to give loans, because you can't be making rules and saying, for instance, Lagos is saying you should now wear masks before going out. If you're going to say that, then you must make sure the masks are available. And it's a good thing because it will create jobs, okay? Along the value chain, those who supply the clothes, those who will sew, those who will distribute, and then if people begin to move, then this is the time to allow the people, the hawkers in the hold-up, to go out there and earn some daily income for themselves as well by going to sell face masks. And if the face masks are readily available, Lagos has 18 million conservatively. Do you have 10 million masks today? For instance. So it's
Isn't this where it has to now come down to the individual? I was speaking with Professor Tomori, the head of the sciences in Nigeria, yes, before, and he did say, look, it's no longer time to continue to depend on government interventions in fighting COVID-19, that individuals need to look at it from the point of view of, look, I need to protect myself, protect my family, and of course protect the rest of the family. Shouldn't we begin to look at at it from what the individual can actually do. I mean, what would it cost, one person to sew a face mask? And then, of course, begin to wake up the volunteer spirit in Nigerians. If you have enough, can you, give to your neighbor and all of that? Can we begin to have this kind of conversation instead of putting it all at the doorstep of government?
I agree with you. Okay, you have a point, and it's also easy for Professor Tomori to say it's up to the individuals. But you see, when you're talking about individuals, how much sensitization? And granted, the media has done its bit, let's be honest, because NBC has made it mandatory, and then everywhere you turn, it stares you in the face. But have we made use of our traditional media? Let me use that language. Time was when we had, town criers, and then in communication, you would walk through influencers in societies, your church leaders, your community leaders, and all of that. How many of those have we incorporated, either in committees and all that? I mean, what's happening in Kano, for instance, is simply because this has not been cascaded down to the grassroots. The Almajiri may not even have time. You may say they listen to radio. How many of them can really afford radios? Okay? So it has not been cascaded down. You see, you cannot take it away from the doorstep of government, because we need to create enough awareness. People need to see and need to hear, but it requires engagement. Okay? Yeah. Have you engaged NGOs, for instance? Have you engaged community leaders, for instance? Because when you do that, then people can truly see the danger. Okay? And, we also have to look at the issue of stigmatization as well. Because when you treat people, there are cases, I had a case in Kenya, for instance, where people are escaping from isolation centers. Why are they escaping? Probably because of the way they are being treated. You must let people know that this is war, and that they are just innocent victims to a very large extent, and that if it happens, it doesn't mean that you're any less. It can happen to the best of us. Yeah. You get what I'm trying to say? So, very true. Yes. So there are things we need to engage right now. Some of these, we have a national orientation agency. You see, if I keep going back to government, as an individual, I'm doing my best. And I'm doing that within my family as well. And we're volunteering where I live and all that. We're doing all we can in our immediate community. But who is volunteering? Who is going to the densely populated areas like Makoko, for instance, and engaging the people there, enlightening them, and empowering them? These people need to survive. And so government must focus on areas like that. People are doing all they can. I mean, we've seen the private sector do what it can. The CBN has said they're going to, but you have to be able to do things that will empower people. Let me give you an example. Yeah. Right now, farming is not something that requires, with farming you can practice social distancing very easily. You cannot talk about lockdown for farmers because you must think about the future. Okay? What you should do instead is, how can you empower farmers and protect them to do their work? In farming, people don't, they don't, tell me street language, gumbody. You know what I mean? It's not like being in a market. So you must empower these farmers right now, get them to go out there and begin to actively work in the farms. Put a lot of money in there, because that is the future. The seed you plant today is what you're going to eat, that you're going to reap in a few months' time, down the line. Okay? So what are we doing about that? Do we really have a strategic grain reserve in this country? Isn't it time now to bring it out?
All right, very interesting question. Victor Okhai, let's put you on hold. We'll continue conversation and ask that very mind-boggling question as to what next. What do we do next? Do stay with us. Welcome back. We have public affairs analyst Victor Okhai, who's been speaking with us on the lockdown, has been assessing it and trying to find out which way forward. Victor Okhai, let me bring in, a warning from the United Nations World Food Programme that said there is a risk of a hunger pandemic based on the coronavirus measures that many nations, including Nigeria, have had to take. Now, bearing that in mind, you wonder exactly what that would mean for Nigeria if we continue this lockdown. And if we say we're not continuing the lockdown, do we even have the capacity or the ability to enforce the lockdown in such a way that we can quickly get results, which is to, reduce the numbers of coronavirus cases in Nigeria?
Thank you very much. Thing is that, you see, we need to begin to think strategically and begin to look at, we can't be blinded by the problems of now to, blinded by problems of now to what lies ahead of us in the immediate and near future. I was talking about farming, before we went on break, and I said, farming is an essential. We need to begin to think about food right now, farmers. Begin to empower them, give them whatever support they need right now. And another thing is, our factories as well, okay? The standards for COVID-19 are not much more than what you get in a typical food factory, where people observe what they should. If you're going to work in a food factory or pharmaceutical factory, for instance, you put on your face mask. You wash your hands before you go in, or where you do food handling, okay? Even in a typical eatery, for instance, where they do what they're supposed to do, food handling, or the procedures that you go through, you wash your hands, you put on your face mask, and you maintain the highest form of hygiene. Now, that can be implemented in our factories, and people who work in places like that can still go back to work, okay? It's implementation that is the most important thing. Now, for our farmers, at the risk of repeating myself, we can empower them and get them to go back to farm right away. And then there are jobs as well, like transporters, for instance. The problem we have is just the problem of corruption in this country. Because even with the so-called lockdown and all that, I know that people are still traveling Lagos to Ibadan along the expressway and all of that, because we have corrupt security forces on the road. But let me not belabor that, okay? Now, transportation, you can insist that on the number you want. Maybe back seat of a salon car, not more than 2, one person in front, everybody masked, okay? And then you ensure that everybody, of course there will be fakes along the line, but they also have their sanitizers. There are basic rules that you can put in place, knowing the peculiarity of your immediate environment. You can put together what is happening in the West. If you do that, and you will find that that's what Trump, for instance, has been fighting. Trump is like a government fighting against a government. What do I mean by that? He has his eyes, you might say, on election, but he's also thinking about the blue-collar people, and he says, we have to get back to work. Americans have to work. Now, that is like negating what the medics are saying. Now, you get people to go to work. So the question is, what do? You're confronted with a dilemma. If people must work, rather than say, no, everybody locked down, can we start thinking, instead of impossibilities, can we start thinking, okay, if people must go to work, what do we need to do? How do we ensure that there is safety? How do we ensure that safety is not compromised? If safety is compromised, what are the penalties? We should begin to think that way, begin to think possibilities because of the peculiarity of our situation, for instance. You're at work right now, for instance, because you're essential service. You're observing the normal social distancing. There are many more organizations that can do the same. And then a lot more people can get to work. And then in areas, for instance, where you find that people are going to cluster too much, like markets and the rest of them, see how you can decentralize them and then get people to police, if I may use that language, them to ensure that necessary safety procedures are put in place. Because in any case, right now, even with the lockdown, there's so much abuse, which is why, for me, it is very ineffective, as far as I'm concerned. And your 1,000 and the 1,000 figure as of today is as far as I'm concerned, we're just fooling ourselves because people have not been tested.
Right.
So many people are hiding; they're not coming out.
Right.
Yeah.
So just for clarity, is what you're saying that the lockdown should be lifted so that we can get a better snapshot of the cases that are unfounded that we don't know yet in Nigeria, or what? Because I'm not
saying.
Right.
Left to me, I would say lockdown.
Right.
But you see, the government itself has has messed it up, if I may use that language, I'm sorry. They have violated, they didn't do it effectively. The first 4 weeks would have done it for us. Okay, but they didn't do it across board. So there's been cross-infections and contamination across board, you know, and we saw what happened during the burial of the chief of staff and all of that. So government is the first violator of the lockdown. So if they're not going to implement the lockdown effectively, okay, if left to me, that's it. 2 weeks, max 3-4 weeks, you lock down, this will be over. If we effect the necessary discipline. But there's no discipline, and there's a lot of corruption here. So now, if we know that we're not going to do that, can we start thinking, for instance, saying, if this is not working as effectively as it should be, what next? And I'm not saying jump next into saying, don't do the lockdown. Face mask, very effective, I think, to a very large extent, because it curtails transmission. In all public places, as we go out, everybody must put it on. But if you must say that, so the thing is, don't go out unless you have it. And if you don't have it, what efforts are you making to distribute? Free to areas that can't afford, to people who can't afford it, and also, because like I said, it's going to create jobs down the value chain, you know, both for those supplying, those producing, those distributing, those hawking it, and all of that. Sanitizers, what are you doing to mass produce it? Can you empower pharmaceutical companies to produce so many so that the fake ones will not be, there will be no room for fake ones, and then produce it very cheaply. Then when you have those in place, then you can begin to say to people, you know, and it can be done within a week. It's a policy issue.
Yeah.
It's a policy issue.
And it's not just a policy issue, it's an enforcement issue,
No,
just like you said earlier.
Policy brings about enforcement.
Yeah, just like you said earlier, enforcement, you know, unfortunately, there seems to be some level of
corruption.
Compromise.
And compromise from the very top.
Absolutely. So what do we do with that, especially when it comes to the enforcement angle of it? Because that seems to be the missing link.
Yes. For enforcement, we're in the communication business, so you can understand when I say that we need to be able to use all the agents of effective, whether mass communication or person-to-person communication right now, we need to deploy so that people understand what is at stake. People need to see visually that this thing is real and that people are dying from this. We need to get influencers, you know, and I'm not just whether social media, whether community influencers, you know, to talk to people. And this includes religious leaders, traditional rulers, and, you know, like in a community, you can have the school headmaster, teachers, people who have influence over people. There are Almajiri teachers, for instance, get them involved and let them begin to enlighten people and say, and then part of the feedback you will get is, from them is, okay, so what do we do? Okay, we're hungry and all that. Then in that engagement, you have to say, okay, calm down. If just do your bit, we will see how we can reach you, how we can do that. And so when there's this engagement, not the disconnect that we have right now between government, people sitting out there and dishing out rules and not connecting with the realities on ground. So when we're able to do that, then it begins to make it more effective. And I can see a lot of volunteerism. I can see a lot of people who are going out there, but sometimes even in the process of, you know, volunteering, you find a lot of compromise because people are truly hungry, okay? But if there's effective communication and people know that there's nothing to worry about, food will get to you, we will do what we can, and people begin to learn to trust government. If you can't trust government, at least get people they can trust to speak to them. When we begin to do that, then it helps our case. But you cannot sit down and legislate when a man is hungry. It's ineffective. It cannot work.
Ineffective, it cannot work. Looking ahead, so we're in our 4th week of lockdown in Lagos State.
5 weeks.
Exactly. Well, exactly.
Yeah.
What do you think will happen? Are you expecting the next time the president will address us that he will extend the lockdown, or do you think he will lift it? What are your thoughts?
Lifting at this stage is very risky. However, I think that a few more people should be able to move. Maybe not necessarily everyone, and movement should also have, let it be a conditional lockdown, let me put it that way, which means that if you must move, you must be fully masked. wherever you go to, okay? Well, I can't talk about gloves necessarily, but there must be sanitizers. This is the time, permit me to say this, I've always wanted to say this. Governors have security votes. For what? Security. This is war. This is the time to deploy those security votes, buy sanitizers and put them in all public places, all public spaces. Okay? This is the time to buy as many face masks as possible and deploy. Buy food and make available. You understand what I'm saying? So this is the time to implement these things. Right. So in Lagos State, for instance, I know Okhai for Cross River has a garment factory. I don't know what Lagos is doing. The population here is huge, you know, but encourage people to be able to produce locally, our own local face masks, and then, so that people can move out conditionally. The same way the same standards you have in food factories, you can have that in offices. All banks and bankers should be able to put in their face, wear their face mask, and then have their sanitizer so that people can go to banks with their face mask equally. The bankers will feel threatened. The people who go to banks will feel threatened. If you enter a vehicle, drivers and conductors and passengers, they are all fully masked. The driver has a sanitizer or whatever it is he has there, even if it's just mentholated spirit. I don't know. I'm not speaking as a medical person, so don't take my word for it there. But whatever is approved, okay? Have that in place so that a bit of movement. So it's a conditional lockdown. If you must move, comply or stay in your house.
Yes,
okay? If we do that, we can begin
place
to bring back, you know, get the economy back on its feet again.
Yeah, and it's important to even note that NLC is actually making masks. At the PTF briefing yesterday, they did actually give out some masks. Yes. All right, thank you so much, Victor Okhai, for joining us on the show this morning.
Thank you for having me.